In the spring of 2022, an epidemiologist early in his career was working at a large local health department in the United States when reports of a rising number of mpox cases started coming out of Europe. By the end of May, cases had been reported in 24 countries. The first cases in the jurisdiction where he worked were identified in late June. Now, mpox cases occurring outside of Africa were very rare and almost never happened previous to 2022. And there had been no large outbreaks outside of Africa ever. On top of that, the mode of transmission in this outbreak was a bit unusual for mpox as well. So the health department quickly became all hands on deck to deal with this situation. Even with that, the number of cases quickly grew. In his jurisdiction, there were 5 cases in June, 81 in July, 405 in August, 187 in September, and 190 in October. Excuse me. Everyone was brought in to help investigate these cases, including our epidemiologist. He was part of the team that would call those who had tested positive. On those calls, he would talk about potential exposures. As this disease appeared to mostly be transmitted through sexual contact, he had to ask some pretty intimate questions about sexual activity. He also tried to help identify anyone at risk for exposure from the person he was interviewing. Unfortunately, in late August, our epidemiologist caught COVID and was unable to continue investigating the calls for a couple of weeks. When he returned to action, a new large team made up of mostly former COVID investigators had been set up to handle these investigation calls. Therefore, he transitioned to assisting with other parts of the response. One of his main activities was to help with the vaccination efforts. He would go to the vaccination pop-up site and register those that came to be vaccinated. While they would wait, he would educate them about the mpox transmission, symptoms to look out for, provide information about the vaccine, and share methods to prevent being exposed. Additionally, he would help deliver the antiviral treatments to those who were affected by this horrible disease. After continuing these efforts for a few months, he got a new job with the state health department overseeing the state's response to the outbreak. There, he would act as the point of contact for the local health department and labs, the subject matter expert when questions arose, and the liaison with the Centers for Disease Control and Prevention, or CDC, and other state health departments when needed. He would provide regular updates and reports to the state leadership and local health departments on the status of the outbreak. After about 18 months in this position, he left for a different health department to work on other diseases. This mpox outbreak is still ongoing, and he still does work with mpox, but on a more limited capacity. Hello, everyone, and welcome. My name is Dr. Jeremy. I am the Everyday Epidemiologist. Today, we are not talking about mpox. There will be an episode about that later, but this time I will be talking about public health in general. Public health is more than just prevention of infectious diseases. So today, I will try to talk a little bit about the incredible breadth that is this field. But before I get into that, a few quick disclaimers. First, the links to the sources I used are listed in the description of this video. Second, this information is being brought to you by me alone as someone who knows a bit about public health. It is not coming in any sort of official capacity from the health department I work for. Third, I will stop periodically throughout the stream for questions. However, feel free to type any questions or comments you have in the chat at any point, and I will answer them as I see them. If you're watching later on the VOD, please leave your questions in the comments and I'll answer them as soon as possible. Lastly, for those that don't know me already, that first-hand account was about me as I was beginning my career in public health. But before we get into who works in public health, I suppose I should give some sort of definition of what public health is. How exactly you define public health depends on who you ask, but they all generally get to the same point. One of the earliest definitions of public health goes back to the 1920s. Charles Edward Amory Winslow, an American bacteriologist and public health expert, defined public health as, quote, the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals, end quote. The CDC Foundation defines public health as, quote, the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as a local neighborhood or as big as an entire country or region of the world, end quote. Got a couple more. According to Peter, let's see, I always mispronounce this guy's name and I probably still will, Peter Endemicong, and Stephen Tenney, public health is a quote, broad term that applies to all entities and their work to improve the health of a group of people. Public health focuses on improving the overall health of the group by improving health of the individuals by various means, including disease prevention, disease screening, and disease treatment, as well as monitoring and modifying the environmental, social, economic, and political environment to improve the health of the public, end quote. Yet another definition, final one I promise, is provided by the Encyclopedia of Health Economics as, quote, the combination of science, skills, beliefs that are directed to the maintenance and improvement of the health of all people through collective or social actions. These programs, services, institutions involve emphasis of disease. Excuse me. Got a little bit of congestion this morning. These programs, services, and institutions emphasize the prevention of disease and health needs of the population as a whole. Public health activities change with changing technology and values, but the goals remain the same: to reduce the amount of disease, premature death, and disability of the population, end quote. So basically, it all boils down to what is known as the 3 Ps of public health: promote health, protect population health, and prevent disease and injury. But what exactly does it mean? What is this health that we are trying to protect? The World Health Organization defines health as, quote, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, end quote. Now, healthcare, or medicine, may seem to have a lot of overlaps with public health. And in many ways it does, but it differs in 2 main ways. 1, healthcare tries to treat those who are sick and make them healthy again, while public health aims to prevent people from getting sick in the first place. And 2, healthcare focuses on the health of the individual, while public health is dealing with the entire population. Based on all of this, I'm sure you have some thoughts about who and what professions are part of public health. So I want to take a couple minutes now to let you put some of your thoughts and ideas into the chat. I'll also take any questions you may have at this point. So who, in your mind, based on what I just covered, works in the field of public health? And while you cover that, I will define talk about what this picture is. So this picture is me when I was living and working in Cambodia, and I am giving this child a vitamin A supplement to help prevent eye disease and blindness. So I worked with this local health clinic, and once a month or every other month or so, we would go out to one of the rural communities to help provide a medication, which you can see on the table, and vitamin A supplements, and do whatever needs to be done. So the funny thing about this is I am obviously very white, and people in Cambodia obviously are not. So many of these kids, especially in the rural communities, have never seen someone like me. Some of these kids got very scared of me just by looking at me. I didn't do anything to scare them, but some of them, as soon as they looked at me, would start screaming or crying. And one kid in particular, not this one that is in the picture, but one of these kids in particular, was so scared of me, screamed and cried so hard that after we gave him the vitamin A supplement, he threw up like pretty quickly. I scared a kid so bad just by existing that the kid ended up throwing up. The parents were laughing their butts off. The health employees were laughing their butts off. Everyone was loving it. Like, they one of the nurses was said, "Oh, they're scared of you. You look like a ghost." So of course we had to give additional vitamin A supplement to that kid because he didn't get any because he threw it all up because I scared him. It was ridiculous, but that was a fun experience, and I really enjoyed going out and into the public and dealing with the people. So let's see what comments and questions we have while y'all are there. Hello, everyone who's made it. Gwen, you made it. Yes. Let's see. Ren says, interesting that they add beliefs to the definition. Absolutely. I mean, that definitely is part of it. Absolutely. Just in time to hear the ghost story. Nice. Yeah, that was a fun story. Had to share. Ladybug over here tried. My cat tried to bite. She wants attention, but she didn't want to be picked up or pet. All right. Well, I don't see a whole lot else going on, and no one's saying anyone that they think might be in public health. So I will just tell you. I'll give you some ideas. Typical cat then? Yes, absolutely. She sings her song that she does. So, next picture. So I have asked around people in the field to see what they think are some jobs and some professions of people that work in public health. And while I had previously known that this was a very broad field encompassing many diverse populations or professions, there were a ton of suggestions that I hadn't thought of. Ton of suggestions. So in order to go through some of these in a somewhat organized, understandable, and meaningful way, I tried to group them into at least somewhat related fields. Some of these professions and fields may be a bit more obvious as to how they contribute to public health, so I won't spend too much time on them. Others are less obvious, so I'll attempt to explain how they fit in. For the remainder of this video, I'll go through these and try to show how what they do is related to the 3 Ps: promote health, protect health, and prevent disease and injury. But first, I want to thank everyone who contributed their ideas and thoughts. I would not have gotten this thorough of a list without you all. So without further ado, here is a not complete list of public health professions and workers. Some of them may shock you. Some of them shocked me. First up, we have those workers that I am considering those infectious disease prevention. Obviously, these are people that try to prevent you from getting sick from a bacteria, virus, fungus, or parasite. These include epidemiologists, like me, which investigate patterns and causes of disease and injury and implement programs to limit or stop them from occurring. Infection preventionists work in hospitals and healthcare facilities to make sure that the healthcare workers in health facilities are doing what they need to prevent or limit the spread of infections within those health clinics. People who work in food industry at all levels, from growing the food to serving the food, work to ensure that the food provided does not get people sick. Also in this group are disease investigators and health inspectors. The next group of people are the ones that I'm grouping into the understanding health and public health category. These include researchers, biostatisticians, and data analysts. All of these help us to learn more about health and public health trends. They also help us to figure out new approaches to public health. Also in this group are program evaluators, quality assurance and quality improvement specialists. These amazing people help us understand what programs are working well, why they're working well, and what we can take from those programs to use in other programs. They also help us to investigate programs that aren't running as effectively or efficiently and how we can improve them. Lastly, in this group, I include laboratorians. These are people that run lab tests for disease surveillance programs, so we know what diseases are out there, food and drug safety testers, newborn screening testers, and those that run environmental testing like water safety. They do a lot of good work to help keep everyone safe and healthy. The next category I'm calling social well-being. These are the people that don't work on infectious disease or really physical illness in general, mostly. But they work on mental and social health and prevention of injury. Just a warning, heads up, some of these professions deal with some pretty tough topics, and there might be a little bit of a trigger warning in some of these. This category includes those that work to prevent domestic violence and intimate partner violence, social workers and caseworkers and managers, addiction management, adult protective services, and child protective services. Also here are harm reduction services, which are people that help address substance abuse and work to decrease overdose. Much of their work is done by ensuring that drug users have safe environments where they can use, and overdoses are able to be dealt with quickly if they occur. They also help to provide clean needles to limit transmission of bloodborne diseases. Related to that are behavioral health services, those that help lead to recovery from drug addiction. Food banks and those that work there are in this category as well. Providing food to those that need it is critical to public health. Service dog trainers help provide services that can limit injury, disease, and death. And lastly here, this one may shock you all a little bit, is sex workers. Yeah, sex workers. They sometimes work in public health. In many areas, sex workers have been very instrumental in providing health education to others. They have also helped health departments distribute Narcan, which is a drug that can help stop opioid overdoses. So yeah, even someone like a sex worker sometimes can and does work in public health. Yeah, absolutely. Up next are the educators. Teachers and professors teach about health, disease prevention, and some specifically teach about public health to educate the next generation of public health professionals. Science communicators, especially those that communicate about health topics, do the same thing just outside a community or a classroom, outside a classroom setting. Sex educators teach about safe sex and the risks of sex to help prevent injury, disease, and yes, sometimes even death. Lastly, in this category are social marketers. These individuals use social marketing to help enable social change related to a variety of topics, including health, education, environment, civil society, and much, much more. Education is one of the most powerful tools that exists to prevent disease and promote health. One study in 2020 suggests that up to 80% of all cases of heart disease, stroke, and type 2 diabetes, as well as 1/3 of all cancers, can be prevented through health education. Education is super important, and we all need to support access to good education for all people. So I also want to explain this picture a little bit. So the woman in purple is one of the nurses that I worked with in Cambodia. And this was one of our other outreach programs where we would go out and share some health education with some of the community. We would weigh the babies to ensure that they are at a healthy weight, and help provide some medication, as I mentioned before. So here she is working on educating some women in the community. As you can see, the woman in the background has a education pamphlet that we helped provide. Susan, all levels of education affect public health from preschool to higher education. Yay for teachers who help people become healthy, functional members of society. Yes, absolutely. Gwen says, makes sense. Throughout the history, the quote, management of sex workers in cities was considered a public health issue, and that was the reason why they were so regulated, especially during syphilis outbreaks. Absolutely. Yep, absolutely. Ren, forgot to mention this earlier, but the Navy has 2 hospital ships, the Mercy and the Comfort, that can be deployed wherever needed to provide water, medical care, and other emergency responses. Well, there you go. Military. Military can work in public health sometimes. There you go. Absolutely. 100%. Yep. That's fantastic. That's fantastic. Up next, we have environmental health and animal health. This gets us into something called One Health. According to the World Health Organization, quote, One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes that the health of humans, domestic and wild animals, plants, and the wild environment, including ecosystems, are closely linked and interdependent, end quote. I will do a full episode on exploring One Health, but for now, let's just touch on some of the public health professionals that work in this field. These include veterinary workers and other animal health workers, animal control, especially when they help remove dead carcasses before they can spread disease, and when they capture animals suspected of having rabies. Environmental toxicologists study the effects of toxic chemicals on organisms in the natural environment and ecosystems they belong to. This can greatly impact the health of human populations, especially as we pump so many toxins into our environment. Lastly, are the amazing people and organizations that work to restore and protect the health and sustainability of our ecosystems and environment. Protecting the health of the planet that humans live on protects the health of the humans. So with that, I think this is a good time for a quick break to see if anyone has any questions or comments or any other jobs, professions, or fields that may have missed in the last 5 categories. So, what do y'all have for me? Y'all have any other ideas or any questions at this point? Susan heads up for native plant or organizations. I assume that's what that is. Yeah. Plant native plants. Don't plant invasive plants. Let's try to help restore the ecosystem to what it should be. And bringing in invasives can destroy the ecosystem and destroy our environment and destroy our health. So, plant native, absolutely. Anything else? Anyone else got anything else? Well, I'm not seeing anything, so let's get back to it with the policy and law category. And Kitten, Ladybug, you need to move out of the way. Okay, thank you. Walked right in front of the monitor so I couldn't see my script. Thanks, Kitten. Now, I know that especially in the modern era, it feels like many or most people in the policy and law category aren't working for public health, and some are actively working against it. Yeah, I agree. But there are some that still do support and work towards the health of the population. In this category, I have elected officials, some of them at least, health advocacy and lobbyists, health policy writers, and community organizers and leaders. Also here are those that work with safety, compliance, and law. Public health attorneys, pharmacy compliance workers, safety regulators, radiologic safety employees and investigators, and other regulatory boards that try to limit the release of harmful chemicals and wastes into our environment, all work within public health. Oh, I forgot to change the picture. Well, here's the picture for that group. Now, this next category may be one that most people haven't thought of or expected. This one includes individuals that work with the built environment, or the environment that humans have created and built. Civil engineers and city planners ensure that roads are designed to limit the likelihood of accidents. They ensure there are parks and recreation areas for our mental and social health. They design safe walking and biking areas to promote health and limit injury. They make sure our infrastructure is as safe as possible. Construction workers work to build this safe infrastructure and safe and healthy housing and buildings. The zoning managers try to limit the impact of pollution, noise, and other noxious effects on the population. Traffic controllers set up safe intersections and speed limits to help try to decrease injury and death. Waste management or trash collectors work towards public health. Removing trash helps limit the spread of disease. Water treatment engineers, as well as sewer cleaners, maintainers, and septic designers, installers, and inspectors, help to remove human waste and bacteria and the bacteria associated with it from our drinking water. Fire marshals come up with fire safety protocols and regulations. Auto mechanics ensure that vehicles are as safe as possible in order to limit the risk of them breaking down while in use and thus limiting injury and death. Homeless shelter managers, workers, and volunteers, as well as those working for NGOs that fight homelessness, help provide safe, healthy housing for those without it. This 100% helps protect the health of these people. Unions and occupational safety and health organizations fight for worker safety procedures and regulations. And this is just the beginning, just scratching the surface of all the different types of people, professions, and fields that work to promote and protect the health of the population through the built environment. Up next, we have those that work in technology. Web and software designers and developers work to develop programs that all of these professions use to help us do our job more effectively. Without the disease surveillance databases that I use on a daily basis, there is no way I could do my job. IT, information technology, or information, IT, IT support help desks, that sort of thing is what I was trying to get at. It's critical for public health. They help keep these databases and all of our electronics functioning. Without that, public health becomes much, much more difficult. I mean, I can't tell you how many times I've had to call IT support to, unlock my computer or, unlock access to my databases, or when something malfunctions, and without it, I can't do my job. So, they help me. They help me do my public health work. So they work in public health. Susan, trash collector job has such a poor reputation, but is a most essential job. It is. It absolutely is. It is very, very essential. That is one of the biggest developments that has helped prevent the spread of infectious disease in modern society. Absolutely. Trash collecting is important. Very important. Ren says, absolutely, Susan. We see it every time they go on strike and trash mounts up on the street, how quickly things get bad. Very grateful for those service workers. Absolutely. Absolutely. Or just go to a country or an area in a country that has limited to no trash collecting. It's nasty. And it's not just bad for human health, it's bad for the environment. Health is bad for animal health. And that gets us back into the One Health, and it is all bad. So yeah, removing waste and safely and to the best of our ability, healthily, disposing of the trash is important. So up next is category is the category, there we go, that is very important when crap hits the fan. These are the emergency responders. EMTs, or emergency medical technicians, support public health from the front line. Also here are the other first responders like firefighters and police officers. And after mentioning them, I can't not mention the 911 operators or the other emergency phone operators, whatever that number is for your country. They work tirelessly to help keep people safe and are often forgotten while other first responders are thanked. So I want to thank them now. Thank you all very much. They are amazing people. Those that work in disaster relief do a lot to help protect the health and safety of people after horrible things happen. You think about the people that went to New Orleans after Katrina, or those that respond after a large earthquake, or after a tsunami, or after, a large wildfire. All those people help to provide clean water, clean food, help get the infrastructure built back up so that human waste and trash can be disposed of properly. And they work to fight and limit disease. So, yeah, disaster relief responders are critical. And I want to thank, once again, all those in the first responder chain of action, and to those that go to the side of disasters to help others. You all are heroes, every single one of you. And finally, we come to the last category. I left this one for last because this group is more public health adjacent. These are those professions that are typically thought of as healthcare. While some in all of these professions can and sometimes do work in public health, most of what they do is healthcare and not public health. But but I thought I would mention them nonetheless. So doctors, nurses, therapists of all kind, and other mental health professionals, pharmacists, dentists, and physical and occupational therapists. They all work in public health in sometimes in a limited capacity, sometimes not. Like like my boss, he is an MD, he is a doctor, and he works in public health. So some of these people in all of these professions do work in public health on a broad level, some of it on a more limited level. So while many or most of these professions I mentioned in this stream are typically done by people. Oh, here's a comment. I'll get back to what I was saying. Susan says, from Ken, people who work in the defense industry work in public health by protecting people and preventing war. Yeah, yeah, they certainly can as well. Absolutely. And as we mentioned earlier with Ren's comment, yeah, the military can definitely work in public health. Absolutely, definitely. Prevention of death by war is definitely working to or working towards public health. Absolutely. Thanks for that suggestion. I appreciate it. All right, so what was I saying? I was saying, while many or most of these professions professions I mentioned in this stream are typically done by people getting paid as part of their job, I do want to mention that there are also a lot of volunteers that do all of this for free. Doesn't matter if you're getting paid or if you're donating your time. If you are protecting health, promoting health, or preventing disease or injury of a population, large or small, you are working in public health. And now with that, I will stop and take any questions you may have. Also, I'm curious, how many of you work currently or have previously worked or are trying to get into public health? As he touched on technology, what are your thoughts on AI in the industry? Do you see many cases where it can help research, etc.? What are the drawbacks? Do you see AI replacing public health jobs? That is a fantastic question, Gwen. So I have very mixed feelings about AI. It certainly can, and in many ways already has had positive impacts. It certainly can help support public health. It can definitely help promote, support research. There have already been numerous examples of AI helping to come up with new drugs or investigate protein structures to help us learn more about diseases and how they function. AI certainly could help in a lot of areas. Definitely could help in public health. I mean, it could help us develop more effective outreach programs. Absolutely, it could help us learn more about disease transmission, or well, maybe not necessarily learn more about disease transmission, but it could help us determine disease transmission based on the data that we have. So yeah, I think it definitely could have some positive effects. Are there any drawbacks? Absolutely. especially currently. AI is still very much in its infancy and has a lot of problems. It is frequently wrong, very frequently wrong, and it's the training of the AI is sometimes problematic and can lead to wrong or bad things. So we do have to be careful with that. Yeah, it can. It definitely does have some drawbacks. But do I see it replacing public health jobs? Not anytime soon. Um, I mean, I definitely don't see AI being able to do the disease investigations, calling the people going out into the community to promote the health, going out to, you know, do the vaccines, to share the information. AI isn't going to go out into the homeless camps to share information about diseases that are spreading. So I don't see it getting rid of public health jobs completely. Maybe partially. I see it more of assisting public health jobs. What parts of public health could AI replace? Again, I don't know if it necessarily could, at least anytime soon, in the capacity that it has currently. I don't see it replacing public health jobs in any way. I see it enhancing and supporting public health jobs more than anything else. And yeah, AI can't put vitamin A in the child of a mouth, child of a mouth of a child. An AI can't call a person. Well, I mean, they could call a person, but then if they can't get in touch with them, they can't send a letter. They can't go knock on the door trying to find the person to interview them. There's it could help. It could help. I don't see it replacing a whole lot, especially in the capacity that it is. Yeah. But that's a very good question, and that's definitely something that a lot of these professions need to look at, as to how AI can help enhance the public health. It could help design healthier and safer cities. Could help design healthier intersections or safer intersections. It could help improve the emergency response. I could definitely see AI helping in a lot of ways, but I don't see it replacing it anytime soon. Susan says she is working in public health by adopting a cat and a dog. These babies are not wandering around the world getting sick, spreading disease to others, and killing native animals. Yeah, definitely. Hello, Kyle. Welcome. Gwen, maybe to a certain degree, we already see it in call centers, etc. AI and chatbots are being used to triage callers before pushing them to the right services or even answering most questions. Yeah, absolutely. It could help with that, absolutely. And I guess in some ways you're right. It is replacing some of those jobs potentially. But yeah, and it certainly can. I mean, and where I am, we do have. It's not really completely AI, but we do have auto generated and sent emails and texts. Now we typically you know very heavily curate those and say what will be sent when, but yeah, I mean, we do We are starting to use AI, absolutely. Gwen, not that you're a fan of it. When you're to the point of calling any services, you need to talk to a real person. Yeah, I agree. I think AI in that capacity can have some benefits in certain situations. Yeah, Gwen and or Whisper and Ren definitely agree with you, Gwen. And Susan would hang up on an AI call that started asking you personal questions, give you a person they can have a dialogue. Yeah, yeah. I mean, it in some ways I think it can be beneficial, in other ways it can not, and even be harmful. I mean, if you have to go through an AI bot for 10 minutes just to get to someone to get in an ambulance to come to you, that can be a big difference between life and death. So I think in some ways it could be beneficial, and in some ways it is, but it's definitely not perfect. I agree with that. I hope they never get implemented on emergency services. Can you imagine calling 911 and getting an AI on the other side when you're bleeding out? Yeah, exactly. Exactly. I completely agree. So yeah, AI in certain situations may not be the best thing, especially with the capacity and capabilities that it has currently. Might get to the point where it's better and more efficient, but at this point, yeah, no, definitely not. Calling 911 or whatever emergency number you have is you want to talk to a person. I want to talk to a person at this point. At least I do. Yeah. So any other questions, comments, ideas about people who work in public health? Do any of you, as I mentioned, as I asked previously, do any of y'all work in public health? You don't have to tell me what you do, but do y'all work in public health based on this this video, this stream? But well, thank you all for your discussion. Actually, Whisper says some of the AI nonsense is downright dangerous or harmful. Oh yeah, absolutely. Yeah, AI is not perfect yet, and honestly, I'm not even sure how I'd call it good yet. It's, it's still very problematic. Still very problematic. Well, let's go ahead and move on. So, as you just heard, public health is more than just people that work in health departments. It is more than just the World Health Organization, the Centers for Disease Control and Prevention, the EU Centers for Disease Control or Prevention and Control, the UK Health and Securities Agency, or the Chinese CDC or the Africa CDC. Hello, Anna Banana. You work in public. Good morning. You work in public health, and also not sure if you mentioned it, but medical services and detention facilities is public health too. Yes, absolutely. I didn't mention that, but absolutely, that is 100% public health. Very much so. Actually, I actually mentioned something in back up here that I either skipped to. I did skip over it in my script, but related to that, prison abolitionists are fighting the good fight and help promoting the health of people. Prisons are not very good for public health, both mental, social, and um, physical. So yeah, absolutely. Whisper, humans aren't perfect either, but generally speaking, they're not out to harm or endanger other humans. In general, yes. Some unfortunately are, but in general, you are right about that. But yeah, so public health is, as I said, is more than just those that work in these disease prevention organizations. There are so many people that work in public health, whether they know it or not. But now you do. You know it. So I want to thank you all for joining me today. If there are any questions or comments that I have not yet answered, please leave them in the comments of the video when they become available. And up next, I will talk about the Tijuana River sewage crisis. Yeah, sounds nasty, I know. But it is so much worse than you think it is. So be sure to subscribe to my channel here on YouTube, as well as follow me on Bluesky and Instagram, where I share lots of disease and public health information and news between episodes. You can find the links to those in the description. Stay healthy, stay happy, and remember, public health is for the good of everybody. I'll see you next time.